Hi, high-performing ladies. Dr. Rika here. I wanted to share with you 4 words that you should never hear your doctor say, and those are, your labs are normal. And so, like many of you, I am really passionate about being highly productive and high energy, and to be able to get through my day and not say, boy, I wish I had the energy to do that. And for much of my life, if you know my story, I was like that until I really came to discover functional medicine and learn what is wrong with the way we were trained in allopathic medicine. And this is not to poo-poo allopathic medicine. It does have its role, but that a closer lens sometimes needs to be taken. So these labs I've written here were done on a patient of mine. This patient then took her labs to her primary care doctor, who said, your labs are normal. And there could be nothing further from the truth. And unfortunately, this patient was experiencing a little lower energy. And what commonly happens is when a doctor sees you and says your labs are normal and there's no answer, sometimes they will even suggest maybe you're depressed. And that this level of abnormality is not depression. It can certainly make you feel tired and feel like you might be depressed, but it's definitely not depression. So let's examine these 3 values. So blood sugar, this person's blood sugar was 101 and the doctor said they're normal. 101 puts someone into a pre-diabetic range, anything over 100. And unfortunately, optimal levels are less than 80 or maybe even less than 75. And when your blood sugars go up over 100, that means the blood sugar is not getting into the cell and it can render you more fatigued. It also is a signal to the body to release something called insulin. So when you're taking in carbohydrates higher than your body needs and not burning it off, your body will then release insulin as a result. Over time, what happens is that blood sugar spikes, the insulin is released and then it drops. It can make you sugar crave and it causes a further increase in insulin. Over time, that insulin does not work as well, and we call that insulin resistance. So this is seen when values are up over 4 to 6. And guess what? When that insulin rises and you are subtly insulin resistant, it'll make it harder for you to lose weight as well. And it'll render you inflamed. And remember, a lot of our symptoms and disease are caused by levels of inflammation, and this is just one of them. And unfortunately, what happens is if your blood sugar is dysregulated, going up and down and up and down, not only can you have afternoon energy lulls, but you can wake in the middle of the night, and this is oftentimes seen. So really eating a balanced diet and looking at carbohydrate load, which we'll review in a future video. Lastly, the A1C here at the bottom, this patient was near optimal. So A1C, what that means is it's a marker on the blood cell for glucose, and the blood cell lives for an average of 3 months. So it's a 3-month average of blood sugar. So if you just eat poorly for one night, it won't throw this value off. And for brain health, which is something I'm passionate about, because if I'm going to live to be 100, then I certainly want to be optimally well. And unfortunately, once we hit 80, the risk of having Alzheimer's is quite high. It's 1 in 2 people. So I don't want to be demented in that older age. But they think that dementia is actually a form of diabetes on the brain. So for optimal brain health, we want that value under 5.4, not at 5.4. So you can see how these suboptimal levels, if they're detected early enough, are more easily remedied now than when later it becomes a further problem. So if you want to stay high performing, make sure you never hear those 4 words. Your labs are normal. Signing off for now.